My mom was tough. She comes from a big Italian family. She didn't deserve to die like this. She died like the thousands of others, like a dog.
Strong words from Michael Arcuri, who wants his mother's death certificate to accurately reflect the last weeks of her life.
Just killed her within days.
Louise Arcuri spent her last 4 years in Central Island health care after a lifetime of medical and mental health problems. It's where she got sick with coronavirus on March 30th, 5 days after a state directive said COVID-19 positive patients had to be allowed into nursing homes. Yet when Louise Arcuri died across the street at Plainview Hospital from COVID-19 pneumonia and sepsis, which led to cardiac arrest, the nursing home was not mentioned.
I think it's line 4G. It doesn't have where she was transported from, which was Central Island.
The missing information on the death certificate has Michael Arcuri wondering if his mother was included on Central Island's list of 25 confirmed or presumed COVID deaths. Assemblyman Ron Kim of Flushing said it hasn't been easy for families to follow medical paper trails.
We have constituents that have been asking for weeks to get records.
We've already told you about one man who was sent home from a nursing facility with COVID-suspected fever.
They didn't tell us, and they sent him home to us in horrible condition.
But families who thought they had legal options learned a state provision protects nursing homes from most pandemic-related lawsuits. Personal injury lawyer Sanford Rubenstein.
The governor knew what he was doing when he did this, and obviously it was to protect the nursing home industry.
Governor Cuomo's senior advisor begs to differ. Richard Azzopardi called me almost immediately after I wrote to the governor's press office. Quote, the immunity was needed to get the nursing homes and hospitals to work as one system, Azzopardi said, pointing to the extreme shortage of patient beds the state was expecting at the height of the pandemic. Quote, everyone was telling us we had to quadruple the size of our hospital system. Many states did some form of these laws, Azzopardi added.
There's really no state in the nation which has granted nursing homes and their owners such broad protection.
Now, when you're given corporate immunity, when you can't be charged for standard negligence, they're no longer incentivized to invest in PPE, extra beds, extra staffing.
The Greater New York Hospital Association, which includes nursing homes, contributed more than $1 million to the State Democratic Committee in 2018 and also gave to Governor Cuomo's reelection campaigns. The governor's advisor said a state crisis made immunity necessary, not political considerations.
The men and women in our facilities have multiple medical conditions and comorbidities, and they are the least able to withstand this virus.
We called the administrative office at Central Island Healthcare about Louise Arcuri's death certificate, and we're waiting for a response. And we're still tracking adult care rehab deaths in this age of COVID. We counted 943 in Queens, more than 800 in Kings County and Suffolk, and 750 in the Bronx. Each number represents a story of pain. I'm Mary Murphy, Pix 11 News.